Congressman Khanna dropped by our program today and laid out the case for Medicare for All, and it's brilliant the way he puts it all together. Check it out. Leave your comments, ding the bell, share it with your friends, and please subscribe to our channel.
Hi, Tom. Hi, Congressman Khanna. Hey, I'd like to bring up the fact about the debate where Bernie and Elizabeth brought up about the candidates taking corporate money, but they didn't say much about it. It was kind of quick, but it was a fact that should be brought out more. And Kamala Harris, ice bugged out of her head because she thought Elizabeth was going to out her. And this is terrible. People got to know in a democracy what these people are about and what they really do. And it's hidden from the American people what these corporate Democrats actually do. They take money and they go against the American people. And it's not brought out at all, hardly anywhere, and the corporate media will not bring it out. I'd like to hear from you, please.
Well, I agree with you when it comes to the private insurance companies. I mean, there are two things that were said in that debate that need to be responded to. First one, Vice President Biden says that Medicare for All is going to cost $30 trillion. The next sentence should be, well, the current system costs $49 trillion. I mean, obviously, health care costs money. We know that. The point is, what is going to be cheaper? And all of the economists say that Medicare for All is going to be cheaper, and that's common sense because you're taking out the excessive insurance profits. You're allowing Medicare to negotiate with the hospitals. You're taking out the big pharma profits. The second thing is when Pete Buttigieg is accusing Elizabeth Warren and Bernie Sanders of raising taxes, failing to point out that his own plan of having people buy in is going to cost people $4,000 or $5,000. That's actually the cost. Bernie Sanders and Elizabeth Warren are not going to be charging the money to working class folks. They're going to have corporations, employers, and the wealthy pay for it, and it's going to mean lower deductibles. In fact, no deductibles. It's going to mean lower drug prices, and it's going to mean not having to pay $4,000 or $5,000 premiums. So the economics, I mean, there's a reason Paul Krugman, Joseph Stiglitz, Robert Reich, all of the economists who have looked at this think that a single payer makes economic sense with lower costs and provide good benefits. There's a reason, given that consensus, that people aren't embracing it, and that's because of the power of the pharmaceutical lobby and the insurance lobby.